Hello everyone, this is Dr. Myrdalis Diaz-Ramirez here in our new office in DR2SPINE in Tampa. And I'm very excited. I come here to thank everyone. We already have over 100 followers here in our Facebook page. And I wanted to share why I created DR2SPINE, why I created our method, and what it is. Because it's a question that many of you have asked me already. And then later I'll do this in Spanish for those who speak Spanish. But I wanted to come here, say thank you, because we already have over 100 followers. And this was our open house just last week. So the DR squared restore motion method for spine pain, I created that because I was tired after so many years of seeing so many patients who were coming to us with very similar complaints. They had repetitive injections that were not helping them, steroids, seeing multiple physical therapists, wanting to avoid surgery, wanting to avoid opioids, or having gone through those in the past and not wanting to have any more of them. We saw very predictive patterns. Many patients come and they don't have optimized, they have not been optimized for their health. So our first step is to get that patient primed. So we make sure that we're not working on patients who will not benefit fully from our method. So if you're somebody who will need maybe some lifestyle changes, changes in your weight, changes in your other issues like sleeping, many things that will affect the results of our injections, we can help you get there so that you get the best benefit of your therapy. Some of you will need maybe some amino acids, things that will help you build better blocks for your regenerative treatments. So that's our priming. And yes, I'm using my tablet that I use in our clinic for our patients. Here we put your MRI, we explain everything. We even connect, if we're doing an ultrasound on you, we even connect this here so that you see part of your treatment. Our second step is mapping, so we find the true source of your pain. A very common issue that I see with my patients is that many physicians, and these are the constraints of modern medicine, we have during the visits in the system, we call it the system, the insurance system, patients have to be seen very quickly. And many patients tell us that they were not even examined, that the physicians saw their MRI results, not even the images. And from those results, they went directly maybe to a recommendation of surgery, for example. In our case, we map. I really will take care of you in terms of listening to you, listening to your evaluation, where the pain started, and all your pain history. We'll also examine you thoroughly to find out where that pain is coming from. For example, the spine is a functional unit, the whole unit, and many things can be hurting there. It can be the ligaments, it can be the joints, it can be the disc or stenosis, and we take a look at each element. So that's mapping for us. The next element is going to be targeting, and we target with precision. I've heard also some other patients who have been to regenerative therapy clinics, and they do this by palpation or by just by feeling. We see what we're doing. We use imaging. We use imaging through fluoroscopy, which is x-rays, or we use ultrasound. Whenever we can use the less radiation, we'll do that for our patients. Whenever we need a combination, we'll do that. But we will not inject you without looking at what we're doing. We want to go to directly the exact source of your pain. So that's targeting. Our next treatment is repair. We use regenerative treatments. We don't use steroids. Steroids are what is commonly used in our insurance companies. That's what they approve. Unfortunately, even though steroids are great at decreasing pain, at decreasing inflammation very quickly, they can destroy tissue. They can destroy your bones. They can give you some other side effects. So we try to treat our patients who are eligible for these therapies with regenerative treatments, where we're helping your body restore itself. And then that's where we go, to restoration. So after we've done your treatment, we don't leave you alone. You don't have to travel outside the United States to clinics that will do the treatment and not follow you in person. I am the physician who determines your plan of care. I am the physician who follows your plan of care, who does it, and who will follow up with you so that we make sure that everything is completed. So that is our method. That is why I've created, because I've seen those patterns inside the insurance system that we have here, and we have created this concierge clinic for your care. Thank you for following us. Thank you for your support. Thank you for your trust in me through the years, and I'm very happy to be servicing now you in Tampa. I hope you can visit us. Our website is DR2SPINE, DR2SPINE.com. Our phone number is 813-597-3405, and Dario will be happy to take your calls, answer any questions. I'll be more than happy to see you here in our clinic. We also do telemedicine for the state of Florida and also for the state of Oregon. Have a wonderful week.